Welcome back to my channel. Today, we're diving into a quick but important microbiological test, the Catalase test. What is it? Why is it important in pharma? Let's find out. What is the Catalase test? The Catalase test is a simple biochemical test used to identify organisms that produce the enzyme catalase. This enzyme breaks down hydrogen peroxide into water and oxygen. When you add hydrogen peroxide to a bacterial colony, if you see bubbling, that's a positive catalase reaction. Principle of the test: catalase catalyzes the breakdown of hydrogen peroxide, a toxic byproduct of metabolism, into harmless substances. The oxygen gas released causes the bubbling you see during the test. Procedure: place a drop of 3% hydrogen peroxide on a glass slide, pick a colony of bacteria with a sterile loop, mix the bacteria into the drop, observe for immediate bubbling, make sure to use fresh bacterial culture, usually 18 to 24 hours old. Also, avoid blood agar plates as they may give false positives due to RBCs containing catalase. Interpretation: positive, rapid bubbling, catalase present; negative, no bubbles, catalase absent. A positive catalase test confirms the presence of catalase enzyme. For example, Staphylococcus species are catalase positive, whereas Streptococcus species are catalase negative. This makes it a great tool in differentiating between these genera. Importance in pharma microbiology: in the pharmaceutical industry, especially in sterility testing and microbial limit tests, Catalase testing helps in identifying contaminants, assisting in quality control, and ensuring product safety. Quick identification can guide you toward proper action during investigations. Precautions: use a glass slide, not plastic. Plastic can react. Use fresh reagents. Handle hydrogen peroxide with care, it's corrosive. So that's the Catalase test: simple, fast, and crucial in pharma microbiology. If you found this video helpful, don't forget to like, share, and subscribe to Pharmaceutical for more content.